Intermittent fasting is a diet with many benefits, including weight loss, diabetes prevention, and cancer risk reduction. Many people report that this diet helps them enjoy foods better and understands the difference between hunger and cravings, as well as helps them lose weight. However, as with other diets, not everyone is suitable for intermittent fasting, especially those with eating disorders and pregnant women. It is also important to understand the side effects of this diet. The first, hypoglycemia. You may undergo hypoglycemia in the early stages of an intermittent fast, which is when blood sugar gets very low. This can cause headaches, increased heart rate, dizziness, nausea, and possibly fainting. When you don't eat, your body will start burning glycogen, stored sugar, in the liver and muscle for energy, which will then come to burn fat. However, once your body has adapted to burning fat instead of glucose to increase your intake, you should feel better. If you are constantly feeling dizzy and unwell, you can eat a little. Losing weight is never a reason to allow yourself to faint. The second, less cravings for carbs and processed foods. Intermittent fasting provides better blood sugar control because it forces you to fast at a certain time and then add foods that can keep you full for a long time. This helps you control the amount of carbohydrates you eat, and over time you not only eat less of the harmful things. Intermittent fasting also promotes feelings of fullness through the production of hormones that reduce appetite. One study has shown that intermittent fasting reduces the amount of the hormone ghrelin, the hormone that stimulates hunger, in overweight people and improves the ability to switch from burning carbs to burning fat into energy. The third, improved insulin sensitivity. When you eat it, the body produces insulin, which sends sugar molecules into your cells for energy. But pre-diabetics do not respond well to insulin, causing high blood sugar levels. Therefore, increasing the interval between meals may improve this as the body produces less insulin. However, people who are taking insulin-dependent drugs should talk to their doctor before starting an intermittent fast that may interfere with the medication's effects. People with type 1 and 2 diabetes often need to take these medications to lower their glucose levels, so they need to eat often to avoid spikes in blood sugar. The fourth, affect exercise regime. Exercise during intermittent fasting is completely safe. However, you need to change your training regime a bit so that you do not lose energy during exercise. For example, when you are doing 5-2 intermittent fasting, do low-intensity exercises instead of intense exercise like weightlifting, jogging, HIIT on the days you fast. For the body to adapt to the new metabolism. Once the body has adapted, the intensity of the exercises is no longer a problem. For this reason, experts often recommend people who exercise heavily to do the 16-8 intermittent fast instead of the 5-2 or other intermittent fasting methods. Everything has two sides, including the method of intermittent fasting. According to some nutritionists, sometimes intermittent fasting is not a good idea to apply in practice. A few people have been to the hospital with poor nutrition. After conducting a blood sugar test, the doctor discovered an abnormality. The fasting blood sugar level of these people increased and decreased continuously during the day, instead of just rising in the morning like those on the regular low-carb diet. Why can some people normalize blood sugar with the intermittent fasting approach, others can't? Up to the present time, nutrition experts have not found the most accurate answer. They just hypothesized that the problem could be related to the health of the adrenal glands when you started to fast.